What's up, world? It's your boy Chris, and we are back with another thought-provoking, amazing episode of When Does It End? But this time we are in a new place with a new face from Fort Worth, Texas.
Hey everybody, it's Tori. Hello kinfolk, hello skinfolk, hello all folks, and welcome back to another episode. Chris and I have a special guest here with us today, and we're going to drop some real good knowledge for you.
And without further ado, I'm going to let her introduce herself so she can tell you who she is, where she from, what she do, and how she like to do it.
Hello from Fort Worth, Texas. My name is Lisa Mutaya. I'm the HIV Grants Manager for Tarrant County, and it is my honor to be your guest today. So thank you very much.
Welcome.
Miss Lisa, what's the tea? So, When Does It End is an amazing podcast where we talk about what does it take to end the HIV epidemic through the EHE initiative and its 4 pillars of diagnosing, treatment, prevention, and responding. And so if you are one of our viewers, if you are one of our fans, we show up in different spaces, in different places, and talking to different people to get their opinions of what they feel like it takes to end the HIV epidemic in America. Well, before we get into today's questions and topics, I want to ask you, what inspired you to initially get into the field of HIV, and what keeps you moving forward in the work that you do?
I remember a lady that I worked with that had an infant named Hope, and there was no hope for Hope. And so I think that has really inspired me, knowing how much progress has been made with medications and how people can live normal and full lives. And that continues to inspire me to see the end of the HIV epidemic.
That's good. And so with you viewing this space as a place to show up for hope and having so much experience, can you tell our viewers and our audience, how do you spread hope in what you do on a day-to-day? So what do you do?
I think we have to figure out better ways of doing things. We have to figure out smarter ways of doing things. We have to meet people where they are. It's about the people that are in most need and not about the employees of organizations. So I think clients have to be, people living with HIV have to be at the center of everything we do. And we can't continue to doing the same thing and expect a different result.
And so it was something that you said in your prior response that you talked about hope and having hope for change and having hope for the future. And so as I think about the last 5 years, just with everything that's been going on, from entering into a pandemic to leaving the pandemic and now transitioning into a space where we're trying to figure out what resources look like post-pandemic, how has the pandemic taught us how to be innovative or change our approaches to the work that we do in the terms of HIV prevention?
Well, I have to say, I'm more in the realm of HIV care than HIV treatment, in terms of HIV prevention. And it really requires us just to figure out new ways to partner and collaborate, because I feel like that partnership and that collaboration is what's so critical. We have to use like technology. How can we harness technology to help break down barriers, increase access to clients? And so we've had to learn new ways of doing things. You know, our office offered at-home HIV testing. I said we don't do prevention, but we did offer HIV testing. And what we found, it was able to reach some priority populations that we haven't been able to reach through other methodologies. The Latino population, there was a good uptick in requests for home testing because of confidentiality issues, of just stigma. And so I think it has allowed us to do some different things. We reached out and found new partners during the pandemic. And one of our goals had been to have rapid ART in the emergency department. And so through what is now a 2-year process, when someone is in the hospital district where most HIV diagnoses are occurring, people are being found out of care, those individuals are able to start medications in the emergency department. So I think it's really important to find those new partners, to find those new collaborations, and things that you thought you couldn't do may actually be possible.
You've just given us a few lessons that you learned. So are you all using telehealth in any way to help people get to the next level?
So I would have to say, in terms of, my office doesn't deliver services, but we provide funding to organizations to deliver. And so, yes, like infrastructure for telehealth has been set up. That was one of the great things about COVID, is to have the influx of funding that would allow for that, for telehealth. And that just increases access to care and gives other options, because not everyone wants to show up at an HIV clinic for care.
It's a good point. We often, in a lot of the conversations we've had with consumers and folks who work in the field, people are saying they don't want to go into a clinic that has AIDS or HIV on the door just to get a test.
Right.
So we appreciate the fact, and a lot of folks are saying they appreciate the fact that they can test in the privacy of their home. That they can have these conversations with the people they're actually having sex with versus people that they don't know.
Right.
And that's really, really powerful. So thank you all for doing that.
Yeah. I wanted to add just one other thing. So when someone orders a test, they can also order an additional test. So they can get one for themselves and one for a partner or a family member or a friend. It just kind of expands the range or the reach of testing a little bit.
Or one for 6 months later.
There you go. There you go.
And so in your response, I got 3 words are just hitting me in the face, and I can't help but share my 3 words. The first is to create. From based on what you told us, you all had to create some new opportunities, some new pathways to reach the people that you were intended to serve. Because as we saw when the world shut down during the pandemic, we couldn't. So you creative. And then you weren't only creative in creating new things, you were innovative. There were things that people weren't doing before. This is the first time that I've heard that people were receiving at-home HIV testing kits, but not just 1, but 2. Acknowledging that like these people are having sex with other people. So not only can you be safe, we're going to increase your self-efficacy to have these conversations at home with those individuals that you are having sex with, an adaptation of the intervention, testing together, but testing together at home. And to connect. So even though you all are not providing direct services, you are encouraging and empowering those who you are funding through the administrative agency to connect with each other and to create and cultivate new collaborations.
You said that much better than I did.
And so being at the top of the sphere, and being able to funnel down resources and funnel down initiatives to those folks that you're funding within your programs, how did you and your team and your staff survive during the pandemic?
I think it's just having a really strong commitment and belief in what we're doing. And when you have a strong team, you support each other. You make sure that people are taking care of themselves. You provide opportunities for people to take care of themselves. And I think just that strong camaraderie and realizing that these are different times that we've never been in, and what do we need to do differently, and how do we take care of ourselves, and then having support for that self-care.
So you bring up a great point, another great point. So in our field, we often tell people how to work smarter, how to work harder. Can you tell us some things that you've shared with your team about how to take care of themselves? Burnout is real.
I'll say one simple example is that people take work home. And so my advice was, when someone gets to the stop sign at the exit of our parking lot, leave work there. Leave work there. Start to take care of yourself. Focus on yourself in that time away from work. And when you reach that stop sign the next day, then let's get back to work.
And I think you kind of answered my next question, because I was going to ask you, how did you survive in the work that you did? But you just answered that. Acknowledging that like there's so much more that goes into what we can do for a community outside of what we do in the day-to-day. If I can't take care of myself, if I can be holistically healthy, if I can be mentally healthy, if I can be physically healthy, I can provide the services for the communities that I'm working with.
Right.
So sometimes as people who show up in the space of communities, we have to know that when we get to that stop sign at that parking lot, we gotta put down our briefcase, let our hair down, take our shoes off, and feed into ourselves, because only through feeding into ourselves can we feed back into the people that we are being paid to work for.
That's good. Baby, you are dropping some knowledge today.
I told you, Dr. Phil, mixed with a little Ellen.
How about some Arsenio too, Mr. Brown?
And so, I don't think we gave you an opportunity to tell our audience and our viewers what you do. Like we jumped immediately into the conversation. So I'm gonna give you a platform to talk about what you do in Tarrant County. What's your focus, what's your goal, so our viewers can know that you coming with it.
And you also said you've been doing it for a while, or that you're not. I forget exactly what you said.
I'm not young.
You're not young. I didn't want to repeat that, but yes, you did. With that being said, how long have you been doing this work also?
Oh, I have been doing public health related work for almost 40 years.
Yes.
For a long time.
Wow.
For a long time.
And I think that, so And correct me if I'm wrong, we are about 40 years into the epidemic. So you've been here from the jump. Started from the bottom, and now you are here, and you are still here.
I have to share something. I was listening to the news last night, and there was a lot of conversation about the age of potential presidential contenders and the current president. And someone said something I really like. It's not your age, it's your ideas.
Oh, that's good. You have to think about this, the oldest president in U.S. history, and also the most liberal.
Yes.
Doesn't that say a lot?
Definitely. And I want to say I have a great team. And I just have to say, throughout the pandemic, I think the team has even gotten stronger. I like to hire people that are well qualified, that are compassionate, that are passionate, and are willing to come to work every day and fight for people living with HIV. And you know what the interesting thing is, most of the work that we do is administrative in nature, and people often think that the ones that are pushing the paper all the time don't care. And so I'd have to say, as far as our team, that is what one of the most important things is, that care is there for the population that we're fighting for every day.
It shows.
And so, and I was gonna say that because I said you made me a believer, because everything that you talked about earlier, how you talked about, we show up to work, and I had to acknowledge that when I hit that stop sign, I have to unwind from the day. I have to take a beat so I can be mentally healthy, so I can move and push forward. And so even in what you just said, there's such a large amount of correlation that I felt it. And I would love to be a member of your team. I know they just love you.
Don't you have enough
I
job?
love you too.
I do.
So I have a question for you, Lisa. So based on all of these different things that we've heard already, what are some specific needs that the folks in Tarrant County need that maybe outside of Tarrant County they don't need, maybe they outside of Tarrant County they do, maybe across the country? I always think HIV care really should be very, very regional, even down to the zip code.
I think people need assistance addressing social determinants of health. People need housing. They need housing. It's hard to have great health outcomes if you're sleeping in a tent. And I'm going to share this. I talked to a young 21-year-old lady this week. I wouldn't call her a lady. My kids are 21. And so she really tugged at my heartstrings. She had aged out of CPS. She was living on the street, at times living in a tent. That should not be happening anywhere, regardless if someone has HIV or not. But I think until we really, really address housing needs, there's going to continue to be barriers, and people are going to come in and out of the system. But I think overall, we think about healthcare as doctor visits, but it's employment, it is education, it is housing, it is having your mental health and substance abuse issues addressed. And so I think we have to address people holistically and people-centered.
And so as you were talking, there's one thing that I want our viewers to know. Well, two things really. One, the social determinants of health are real, and they create a domino effect. If I can't get a job, I might not have insurance. If I don't have insurance, I don't have access. If I don't have access, I can't get what I need, or I might not be aware of what's going on within my body. So if I'm out doing risky behavior, case in point, talk about having sex, I don't know what I'm gonna give to the next person because I was never taught. I didn't have any opportunity to get tested. No one ever reached out and talked to me and asked me what I needed. So what you said is so important. The work that we do is so much more than having sex. Right. It's where we live, where we work, what we've been through, who we are, what we look like, the zip code we beat in, because medical deserts are real things.
Yes.
Food deserts are real
Yes.
things. The perceptions of how people perceive us when we go into a physician's office, not feeling included on paperwork.
Right.
All of these things coincide with our risk, our behavior, how we see ourselves, and how the world sees us.
Right.
So we can't do the work that we do without acknowledging the person as an entire being.
Right. And then I think then you add a language barrier on top of that.
Yes, come on.
So I had a great conversation earlier today with a really nice gentleman from Ecuador, and he talked about the fact that from the country where he's from, he thought homelessness was going to look very different here. Unfortunately, it looks the way that it does. And it made me think about how he also talked about how committed he was to really learning English fluently. I was very, very impressed with that. But I thought about intersectionality, and I thought about how navigating Texas for him looks very, very different than it does for someone who was born here in Texas, who was born here to white parents here in Texas, who was born here to brown parents here in Texas, who was born here to black parents in Texas. Can we talk a little bit about how those intersectional identities play a part in the health disparities in Tarrant County?
We're having an HIV symposium tomorrow, and we've had some really great sessions in the past about intersectionality and how you look at a woman of color, but that woman of color could have experience from the South. That woman of color could be from the Dominican Republic. That woman of color could be from Puerto Rico. That woman of color could be from Africa. That woman of color is not the same. Everyone is a unique individual. And so that intersectionality, I think, has to be honored, has to be respected, and it has to be treated with cultural humility.
One of my favorite aspects of cultural humility is the commitment to lifelong learning. We all know a lot, but we need to learn more.
Right.
Folks, there's an old saying, folks are dying that ain't never died before, and it's true. But that also means that folks are getting to undetectable who've never been undetectable before. Folks are living longer and healthier with HIV who've never done that before, in part because of people like you.
Right.
Thank you.
And so I'm going to say thank you for finding the value in intersectionality. Because a lot of times when people work in spaces within systems, we do our work based off of numbers. And we try to place people where we think they should be, and we fail to see them in their identities and how they want to be perceived. For someone who sits in a position of power to say, we have to look at the intersectionality. People are different. Just because you may perceive, or the perception may be that you are a person of color, does not mean that you might identify as a person of color, or your experience might be the exact same as the next person of color, because you might come from a different background.
Meghan Markle.
You might have a different income. You might have a different history. You might have a different narrative or health issue. So for someone like yourself to be in a position of power, to understand that and to speak about that, it makes me so happy, because I know that's what you're instilling in your staff and the people that you're leading, and on a day-to-day it creates a chain reaction, and they're telling those folks. So we create a more culturally aware, culturally sensitive, culturally competent, and culturally agile HIV prevention workforce that sees people as people and not just numbers.
Right. I want to give some great credit to Miss Leisha McKinley Beach.
The Queen. I call her Queen Leisha.
We were with her this past Saturday. She has been here regularly, and I think she challenges us to do better and better. And I'm really hoping she's not going to retire in December.
I don't know how she's going to retire, because we're going to keep calling her for stuff. Shout out to Queen Leisha if you happen to be watching.
So my next question is going to be, it might be a hard one. Okay. It might be a difficult one.
Okay.
But When Does It End is about the EHE, the End of the HIV Epidemic Initiative. And so a lot of the conversations that we have are about the 4 pillars that I talked about earlier: prevention, diagnose, treatment, and responding. And I wanted to ask you, in your opinion, what do you feel like is the most important pillar and why?
Today, because that might change tomorrow, and it may have been different just a few years ago.
So because I'm funded in the treat pillar,
Work.
I feel like the treat pillar is so important for getting people virally suppressed, because if we can really get people virally suppressed, the need for the diagnosis pillar is minimized. You still need a strong testing pillar. If you can get people virally suppressed and prevent the transmission of HIV, the respond pillar becomes really not as important. So I feel like the treat pillar is the driver. It's that driver to get people in care and linked quickly. It's the driver to identify people that are out of care and bring them back in. And so, although I'm funded for the treat pillar, I really think it is most critical, because that is where the transmissions are generally coming from, are people that are in need of HIV treatment.
I think that's really important. There are 2 acronyms that I really, really love. There are a lot that I love, but two that I think are so vitally important to this fight is one, treatment is prevention, TASP.
Yes.
TASP is so credibly important. If every person who's living with HIV got to an undetectable viral load and maintained it, nobody would get HIV. Effectively, the end of the HIV epidemic. We just continue to treat people who have HIV really, really well, making sure that we're addressing all those other social determinants of health. So TASP is one that I'm crazy about, and also U equals U. Science, people have proven U equals U even before the CDC recognized it. And I think that's really, really important. I tell this story often. Many, many years ago, I was at a church revival, and there was this beautiful young couple. And the guy, it was a gentleman and a wife there, and they had their children with them, 3 little children. And he was testifying about how his wife had HIV and God had delivered him, and that he didn't get HIV and neither did their children. And they looked at it as miraculous. And this was before we had the language. People who are living with HIV, who take their medicine and are virally suppressed, have been proving it before we knew it was a thing. And I think there's so much to this. So the treat pillar, I agree. I think treatment is without question the most significant. I'm not even going to use the word important, because we have to obviously find out our status in order to get to treatment. But I think it is the most significant of all of the pillars. And it does in turn make some of the other pillars less of a priority, in the sense that if we're getting folks the treatment that they need, in addition to housing, in addition to folks who need, we have to fight for language justice, in addition to making sure that people have fresh fruits and vegetables and meats and all other kinds of things to complete a well-placed diet, all of those other things, then that's how we're effectively going to end the HIV epidemic.
I just wanted to share, we were working with a consultant, Dr. Moten, in the last few weeks, and she has this great graphic of plumbing, and you have leaks in those plumbing, and that plumbing can be looked as the continuum of care. And why are those leaks happening? And we've got to do more than plug those leaks. We've got to fix those leaks. I don't want to make you cry.
No, I feel like I'm in church.
Well, you got Dr. Tatiana Moten and Queen Leisha McKinley Beach. You all are really knocking it out of the park. This is a star lineup.
We look for the experts. We look for the experts.
I heard the lady you have tomorrow is going to be fantastic.
I have heard too, and she may be wearing a pink shirt right now.
That's on it.
So you told us what your favorite pillar was, but I want to know, based off your own experiences and your own thought, what pillar do you feel that there should be, has the most opportunity for growth or advancement? So on our show, we're going to use strengths-based language. So, because everything has the capacity to always be better, okay? All right.
I think there needs to be universal testing. Everyone should automatically be getting at least an annual HIV test.
May I add, respectfully, opt-out universal testing?
Yes, I agree with that. And I talked about our Rapid Start program in an emergency department. It is based on an opt-out. It is based on opt-out testing that is occurring. So I think that is so critical. I'm not sure I'm going to commit, because I have spoken about the treat pillar, which I think it drives other pillars. It drives other pillars. But I do think that people should have access to that opt-out annual HIV testing. I think that should be a requirement. And then I think people that are diagnosed need to be linked to care really quickly. So it's hard for me. I'm not sure I'm going to commit, but I am going to at least say I think that treat pillar is the driver for so much, because if we can get effective treatment, people virally suppressed, then that's going to resolve most of the transmissions.
And imagine if opt-out testing was kind of the norm.
The standard.
The standard of care.
Right.
Look at the stigma reduction that takes place. It keeps people from being ashamed for having sex. Or from some other activity that could possibly put them at risk for HIV exposure. And suddenly what it does is, oh, you have a sprained ankle, you're getting an HIV test.
Right.
You fell down a flight of steps.
Right.
Well, while we're taking care of your, checking out your equilibrium,
Come on.
we're also going to give you an HIV test. You're pregnant.
Come
Oh,
on.
wonderful. You missed the period. So let's get an HIV test.
Because with that mindset, it kind of normalizes sex to the point to where sex is no longer taboo. And acknowledging sex is the reason that we all are here in this room. Why is it such a taboo thing? So when I go to my physician, it would be amazing just for an HIV test to be the standard, such as taking my blood pressure, taking my weight, and I had the option to opt out of it. Just think how far we would be in the HIV prevention landscape and in the sexual reproductive health landscape if some of these options were the standard and you could opt out if you chose to do so, but it was an automatic. Think about what HIV would look like. Think about what stigma and shame around the sex landscape would look like. Think about how conversations around sex, safety, and pleasure would be so different if this was ingrained as a part of our healthcare and a part of our culture.
Also understanding not every person contracts HIV through sex.
Come on.
So for people who are injection users, suddenly we're able to get them in to get tested because they came in because they're having trouble with the vein.
Come on.
So suddenly we changed the dynamic and we even changed the power structure because it's no longer just people who are quote unquote sick getting tested for HIV or people who quote unquote high risk.
Right. I guess I would, to me, this just bodes the discussion of status neutral. So those people that are getting tested that are negative, that have a risk factor, be offered PrEP. I mean, that is just a key tool to ending the HIV epidemic. And so I think, to me, it's all connected and it's difficult to dissect it. But I do think, a status neutral approach is really, it's really critical.
So can you tell us a little bit more? We want to make sure everyone that's watching understands what status neutral is. I will be very frank. I was not a fan of status neutral. I think there are times when people need to hear things that are messages specifically tailored to them. And then I think there are other times where general messaging, status neutral approaches work really, really well. Tell us why status neutral you think is such a great idea and how you're effectively using it in Tarrant County.
So status neutral, I look at is no wrong door. If you are entering the system, you are having an HIV test. If that test is negative, we're invested in keeping you negative. To offer PrEP as a tool to keep someone that is at risk of, of having HIV transmitted, that is just a critical tool to keep people healthy. I'm going to say I have a gay son. On the first day, he told me at 19 years of age that he was gay. The second day, I had him at a prevention clinic getting PrEP because I understand from my work life that there's a real risk involved. And so I think we've got to get PrEP reaching not only white communities, but a better uptick in communities of color. So back to the status neutral approach. Your HIV test is negative. You still need to access services in order to keep you negative. With status neutral, the one door would be to care, where you're rapidly linked to care, rapidly receiving medication, and then having services to help support you in that road to viral suppression.
And then I also think too, in the terms of status neutral approach is destigmatize folks living with and impacted by HIV. So I think about traditionally back in the day, you go get tested, you're positive, you have all the resources in the world. You stay in there, people connect. You're negative, you leave out, and you're forgotten about. So those folks who know and see what you do, especially when HIV tested in the club, because that's where I started, okay? Tested in the club, in the back room. And so a lot of that stigma started there because you can kind of tell as being someone in the club, oh, they was in there too long, they must, versus somebody going and coming right out. So I think that status neutral approaches actually kind of destigmatizes HIV in a bit because we're going to let you know that, hey, even if you're negative or positive, we have a resource for you because you have options, right? If you're positive, we're going to make sure that we link you into some form of ART. If you're negative, we're going to make sure we put you on PrEP, or we know we get you some condom distribution, or a group where you can talk about your risk factors, or we can address those social determinants of health issues that you're facing in your life that have increased your risk for HIV. So I definitely agree with you. I think that status neutral approaches just need to be the standard, period.
So I just want to briefly address that, because only within about the last month have our federal partners at HRSA and CDC encouraged a status neutral approach, and they're discussing how funding can be braided to support that. So when you ask how has status neutral been implemented in Fort Worth, it has been challenging because of silos created by funding streams, but I feel like with the new program letter that CDC and HRSA have issued, that it gives some flexibility, some support. Obviously, with Ryan White funding, you cannot purchase any PrEP medications, but referrals can be made. Partners can be informed about PrEP. So there is some space, but I feel like now that that clarification has been provided by our federal partners, it's going to make it a little bit easier. And I'm going to give a shout out to our jurisdiction, because we are getting ready to release a stigma campaign that is called Shut Down the Shame.
Ooh,
and we are very excited about that, and we'll share it with you whenever it is formally released.
We're ready to share it. So thank you for that, Lisa. Thank you so much. So another thing, what it sounds like is HRSA, CDC, some of the major entities that they're starting to get on board, and that they've learned some lessons from COVID. That you can't just fund things as usual, because the world has changed in some ways, and it will never ever return back to what we consider normal. So how has COVID and the COVID pandemic impacted the way that you all administer services, that you reach out to people, that you engage folks in care and retain folks in care?
I think one of the key ways that COVID has impacted business is utilizing telehealth, telemedicine. That removes barriers for clients. Not everyone has the tech savvy. COVID allowed us to assist clients with purchases of phones and some things to help that participation. But I think overall, it has just demonstrated that this age-old system that we have, it can be flexible. It can be more, it can better meet the needs of clients and increase access to care. And I think that's probably what COVID taught us best. It also has taught us we don't have to go to so many meetings in person that waste time.
Come on.
We can do a lot of things through Zoom or Teams or GoToMeetings, and you can have just as effective meetings. And so I feel like that has taught us how business can be more effectively conducted, how it can reduce the amount of time that you're sitting in meetings that are maybe not as productive if you'd like to be. And if I'm being really honest, you can multitask.
I have made it clear I do not want another meeting to figure out when we're going to have a meeting.
Yes.
And so we're almost at the point to where we're about to wrap up. And so I have one question and one final question for you. Are you ready, Miss Lisa?
I'm ready.
Miss Lisa, are you ready?
I am ready.
So in a perfect world, in Lisa's world, what would you envision for the HIV prevention landscape to look like or to be?
I think that all people would have access to HIV testing. It presents challenges because some people are more likely to have access to primary care, and some people use the emergency room for their care. And so I think really just figuring out a way that everyone could have an annual HIV test. And there's real challenges of reaching kind of disproportionately impacted populations. So we have to be really, really intentional. I want to share that we're doing some geomapping, looking at doing an overlay of where people are being tested, where people are being diagnosed, where people are, where they live, and then where are the areas that are most challenged to reach viral suppression, so we can be really intentional and really mindful of those pockets of communities that have the very greatest need that are often overlooked.
That's amazing. Do you have a follow-up?
Well, I love the fact that you all are addressing community viral loads, that you are addressing where people are having sex. Not just the type of sex that people are having, but where people are having sex. And that's really, really important. When you were talking, I immediately started thinking about like partner notification. I know people all the time who say, well, they asked me who I was having sex with. I didn't tell them.
Yeah.
There are a lot of people who never will disclose that information because it's telling on folks, or, and there's even stigma associated with that. But I love the fact that you're being proactive about finding out where HIV is.
And you know what, so to that point, I think about how would services look like, or how different would things be if when someone got a call from a DIS, the DIS asks that individual, where did you find your partner? Where did you all have sex?
Or partners.
Or partners, right? So instead of who, names, or in addition to asking folks where, so we could know where the community viral load is, or where should we be focusing our efforts, or what type of programming should we be creating to prevent HIV from happening in these places.
Right. I was going to say the other thing that I think we will be looking at in this kind of geo-mapping is then where are services located? Yeah. These are our highest risk zip codes. Where's the testing services? Where are the treatment services? Where are the care services? And I'm going to guess there's some deserts that we're going to find.
Without question.
And so I'm going to tell you, so I was having a conversation with an amazing person on your team.
Oh, awesome.
I'm not going to tell you who it was.
Okay.
But she was telling me about an exercise that they had did one time where they were dropped off in one area and they had to navigate the system as if they were somebody experiencing homelessness. And so through that experience, they found out how hard it was to navigate and to find services. So not only geo-mapping to finding out what resources are, but geo-mapping to figure out what assets do we have in these communities so people can get to the resources that they need. Where are our bus stops? Where are our bus lines? How much are the Ubers and the Lyfts in these areas? Do the Ubers and Lyfts even want to come to these areas to make sure that people can get to where they need to go to get tested, to get resources, to get condoms, or to have conversations, or to seek counseling and get support and need about some of the things that they're facing that increases their HIV risk?
I love it.
It's not simple.
It's not simple.
But I think it's really doable. And I'm going to get back to that hope we talked about at the very beginning. It takes that hope and it takes having that vision. And I think we can do great things.
Well, I'm going to ask you a question that my mama always asked me. She said, baby, what's the best way to eat an elephant? One bite at a time. So we have to figure out what things look like for us. And we have to amplify, cultivate, and create change one piece at a time. Acknowledging that sometimes we can't take out much more than we can chew, but as long as we are progressing and innovating, cultivating, and creating new initiatives that meet people where they are and see them as people and not numbers, we can be impactful and create a change. Miss Lisa, this has been amazing. This has been thought-provoking, and you have given me so much insight. Before we end, if our viewers would love to get in contact with you, please share your contact information.
My phone number is 817-370-4527. I feel like a telemarketer. My email address is lmutt@tarrantTX.gov.
You heard her. Call her, page her, beep her, email her if you want to reach her, because she got a question to answer for you. Tori, take us home.
Thank you all so much for joining us for one more episode, and we obviously have more to come. We certainly want to thank Miss Lisa, and we want to thank each and every one of you for joining us today. Continue to have wonderful, healthy sex. Continue to take care of yourselves. Have an amazing day.
Bye, y'all.